Gels and creams for the purpose of vaginal tightening. Have you ever heard about creams that claim to tighten the vagina, and people on the internet are telling you about them, running sponsored advertisements and getting influencers and young women on social media platforms to appear and declare, "Come here, my dear bride, I've brought you this special gel that will tighten your vagina, and I've also brought you this particular cream that will make your intimate area glow and ensure that the region down there is perfectly tight." So, what is the purpose behind vaginal tightening? The scientific goal of vaginal tightening is to achieve greater marital pleasure for both the wife and the husband. Scientifically, with advancing age, repeated natural births, and frequent pregnancies, whether the delivery was vaginal or C-section, and the cessation of menstruation, which is reaching the age of wisdom, meaning menopause, what does all this lead to? To weakness in the vaginal muscles. And you'll find that the area down there is quite delicate, just like regular skin, because it's the same type of skin cells present there, but these skin cells are specifically known as squamous keratinized cells, which means they are cells that are somewhat square-shaped, and they contain a substance called keratin to keep the skin firm and taut. Now, the cells found in the vagina are of the very same type, but they are non-keratinized, understand? The area is naturally lined internally with a mucous membrane. The vaginal area itself is lined with a mucous membrane, and its cells are extremely sensitive. The vagina internally is a mucous membrane surrounded by muscles that strengthen it and give this area tone. The vaginal area, you see, is essentially a muscular cavity that contracts and relaxes, and during penetration or sexual relations, what happens to it? There's a widening and relaxation of the muscles to allow for penetration. But when vaginismus occurs, there's an involuntary contraction of the vaginal muscles, which makes this area what? It becomes constricted and closed, and the woman might even experience severe pain during marital relations and so forth. Well, what happens on the internet is that people, companies, and deceptive advertisements are actively selling creams online, claiming they will effectively tighten the vagina for women. We tell them, listen, people, there is absolutely no such thing as these claims. Why? Because it functions in a specific way. It creates a temporary tightening effect for 1 or 2 hours. Additionally, certain substances are included in its composition. These particular ingredients induce a slight contraction and a minor swelling of the vaginal mucous membrane. Consequently, this gives the woman a sensation from within that the area is constricted. A slight swelling made her feel that the area was quite tight. It also caused a significant narrowing of the vaginal opening, and this constriction of the vaginal opening brought on by the swelling resulted in a severe dryness of this mucous membrane, which then caused the cells to pull tightly together, meaning the entire area became completely devoid of water. It made the moisture disappear, or rather the cells lacked any fluid. It made, when your skin dries out, doesn't it feel tight and pull? When it dries out excessively, it tightens. So it caused the area down there to dry out. Consequently, with even minimal friction or less intimate contact, the area becomes more susceptible to pain and more prone to irritation or injury. So a woman using these creams finds that the area down there feels what? Very painful. Intimacy becomes painful for her. So she might say to you, oh, the area has become too tight for me. Because of the extreme tightness, intercourse has become painful for me. She's completely misunderstanding the entire situation. These are chemical substances that are being promoted in a deceptive way. This method deceives you into thinking your area is constricted, and this minor swelling is temporary, lasting from 1 to 2 hours. It gives you a feeling of tightness and discomfort. It causes a slight swelling for you, and this slight swelling gives you that feeling of tightness, and at the same time, it also causes severe dryness symptoms in the vaginal area, which makes any intercourse feel extremely painful. This is point number 1. The second point, it could cause you to develop vaginal infections. He told you that it primarily affects the vaginal region. It also impacts the pH balance of the vagina, which naturally causes it to become your intimate area. Your pH, or the acidic and alkaline vaginal environment, is significantly affected. This then impacts the acidity and alkalinity of the vagina, making you quickly susceptible to any infection, whether it's bacterial or fungal. This only resulted in irritation of the affected area, and you became more susceptible to infections. He also told you it affects you not just with vaginal dryness, but also causes severe pain during marital relations. What you need to know is that to strengthen the muscle, medical studies have recently shown that within 6 weeks of doing pelvic floor exercises, the area can become much tighter. So if a woman performs pelvic floor exercises, specifically Kegel exercises, for a period of 6 weeks, this significantly aids in achieving muscle contraction, consequently strengthening these muscles. And he also told you that sometimes we can perform surgery to strengthen and reconstruct the vaginal muscles, and that we work on removing excess tissue and take stitches in what is called fascia, which is behind the mucous membrane. We open the mucous membrane and take stitches to strengthen the area. He also told you about the fractional laser, which is essentially a CO2 laser device that functions to stimulate the production and formation of collagen within the vaginal wall or in the vagina. It does rejuvenation and regeneration, which is the regrowth of cells, and of course it helps tighten the vagina. It also treats cases of first-degree urinary incontinence, provided she doesn't have vaginal infections. If she has urinary infections, we shouldn't do a vaginal laser. Did you know that in Saudi Arabia, they actually banned the vaginal laser because some of the specialists who are using these devices don't know how to properly calibrate them? They go and perform, laser tightening. They went and burned them from underneath and documented it. In Saudi Arabia, there are cases of vaginal burns. Cases of vaginal burns have been recorded in Saudi Arabia due to the use of fractional CO2 laser, and it's being used once every 3 months, not once a month, no, once every 3 months. We conduct regular periodic follow-ups to ensure that this woman who is undergoing vaginal laser treatment does not experience any problems or any other related complications. So there are 3 medical methods responsible for vaginal tightening. First, we have Kegel exercises. They're the easiest, and you should do them every day. Just search online for Kegel exercises, and they'll show you deep breathing exercises, deep breathing. Hold it in. Try to do this. Close your eyes and contract that area as if you're trying to stop yourself from urinating and as if you're trying to hold back gas. So contract. The duration of this contraction should be, for example, about 2 or 3 minutes, then release, then repeat this process, then release again. They say this exercise really helps to strengthen your pelvic floor muscles. To you to sports like squats, going up, going down, squats, specifically squat exercises. Look up pelvic floor exercises online and commit to doing them for at least 15 to 20 minutes daily for 6 weeks. They say it will solve the problem of muscle weakness by 40%. They also mentioned this weakness in the muscles. I tell them that there are people who lift weights, who carry heavy things. She suffers from chronic coughing and also chronic sneezing. She experiences many pregnancies and frequent births. All of these factors increase the strain on her pelvic floor muscles. He told you the very last and most important thing, which you absolutely must understand and be aware of, that you can also use a CO2 fractional laser. This laser to operate emits heat, which then stimulates growth. It emits heat at a very specific setting to avoid burning the woman for a certain duration. I'm telling you, you enter the device and it rotates. A few rotations, we insert the vaginal laser device into the vagina. It makes several rotations. For what duration, for example? For a duration, for example, like 60 seconds, a minute, then you take it out, it spins around again for several turns. What's the total duration for that? For instance, it rotates 17 or 18 times, depending on how we've calibrated the device. So the session duration was 1 to 2 minutes, repeated once every 3 months, and we might see tangible results, but not in all cases, or vaginal tightening surgeries. That's what's available. I hope my episode today benefited you and answered your questions, and I hope you benefit from all my episodes. This was Dr. Haya Hijazi, obstetrician and gynecologist, and thank you.